Hi everyone, and welcome back to video number 3 of our bacterias with exotoxins. Today we're going to go over 3 very specific and high yield bacterias that they like to ask about very frequently on the Step 1 exam. So the first bacteria that we're going to go over is Bordetella Pertussis, and this bacteria inhibits phagocytic ability. So Bordetella Pertussis contains a toxin called pertussis toxin. It's a gram-negative coccobacilli. So if we look in the image, we see that the shape is very round, like a coccus, but also elongated, so a bacilli. That's why we call this a coccobacilli. And because it's gram-negative, this is pink. It will affect unvaccinated children. This is your DPT vaccine that they have not received, and it will cause respiratory symptoms. Also with low-grade fevers, chorea, which is inflammation of the mucous membranes in the nose, whooping cough, or post-cough vomiting, where a child or an adult will cough so much that it actually causes them to puke afterwards. It can also affect the unvaccinated adults, and this is called your 100-day cough. Now, Bordetella pertussis has 3 stages: catarrhal, paroxysmal, and convalescent. The symptoms of the catarrhal stage are mild and they may go unnoticed and they can be asymptomatic. Whereas the paroxysmal stage of pertussis has episodes of coughing with a whooping sound when breathing in. This cough gives the disease its name, whooping cough. The convalescent phase is when symptoms start to improve. So we have 3 stages: catarrhal, paroxysmal, and convalescent. Now, what is the treatment for Bordetella pertussis? Well, there's 2 treatments. The main one is erythromycin. Erythromycin is a macrolide that inhibits the 50S ribosomal subunit. It will stop the transmission of the disease to others, so Bordetella pertussis cannot spread. But TMP-SMX, also known as trimethoprim sulfamethoxazole, is an alternative antibiotic therapy that is given to those who cannot tolerate erythromycin. So your drug of choice is erythromycin, but if allergic or you cannot tolerate it, then give TMP-SMX, which is a sulfa drug. Okay, moving on to the bacteria that inhibit the release of neurotransmitters. The first one is going to be your Clostridium tetani. This contains a toxin called tetanospasmin, which will cleave SNARE. SNARE is a protein that is required for neurotransmission release. The toxin prevents the release of GABA and glycine from the Renshaw cells that are located in the spinal cord. Tetanolysin is another toxin that reduces the tissue redox potential, causing the bacteria to replicate. Now, the signs and symptoms of tetani are spastic paralysis that leads to muscle spasticity or muscle spasms, trismus, which is the medical term, but this actually means lockjaw, serious breathing difficulties, but the 2 main ones is your rhizus sardonicus, which is your raised eyebrow and open grin. So they kind of look like the Joker. And opisthotonus, which is spasms of the extensor muscles causing a backward arching of the head, neck, and the spine. So if you look at these 2 images that I've given here, here's a Joker, and he has a raised eyebrows and an open grin. This is rhizus sardonicus. And this patient down here has spasms of all his extensor muscles, causing a backward arch of his head, neck, and his spine. Now, what is the transmission of tetani? The transmission is that tetani is commonly found in soil, saliva, dust, and manure, but can also be found on human skin and in the gastrointestinal tract. So if it's a wound, it will usually be due to a puncture of the skin from a rusty nail. Trauma will be from a human bite because saliva has tetanus, or an umbilical stump infection, which is unhygienic delivery or improper umbilical cord care, which will lead to something called neonatal tetanus. Now, this is a form of generalized tetanus that occurs in newborns. Infants who have not acquired passive immunity from the mother and have not been immunized are at risk for tetanus. It usually occurs through infection of the unhealed umbilical stump, particularly when the stump is cut with a non-sterile instrument. Now, how do we treat and prevent tetani? Well, we can prevent it with the tetanus vaccine, but there's a total of 5 doses of tetanus vaccine administered at appropriate intervals, and it's considered to give lifelong immunity. So 3 doses of the vaccines are in a 6-in-1 vaccine that is given at 2 months, 3 months, and 4 months of age. The 3 doses of vaccines are given as your TD and IPV. Each is given 1 month apart. So 2 months, 3 months, and 4 months, you receive 1 vaccine at each month, equaling 3 total vaccines. Now, TD, I have put here, stands for tetanus and diphtheria, and IPV is your inactivated polio vaccine. Now, the 4th dose is 3 years after the primary course, as part of the DTaP and IPV. This is known as your preschool booster at 3 years and 4 months to 5 years of age. Here we add the pertussis toxin to the vaccine. Finally, we give the 5th dose, which we give 10 years after the 4th dose. So this is between age 13 to 18. This is known as a school leaver booster vaccine, and this is given as a TD and IPV vaccine. So TD was your tetanus and diphtheria, and IPV is your inactivated polio vaccine. And then to treat the muscle spasticity, we can give diazepam or a benzo. The second bacteria we're going to talk about is your Clostridium botulinum. Now, botulinum is an anaerobic, gram-positive, spore-forming rod commonly found on plants, in soil, water, and in the intestinal tracts of animals. It is an alpha-beta polypeptide neurotoxin that is coated by a prophage. Botulinum toxin is heat labile, so it will also cleave snare, and it will prevent the release of acetylcholine, causing a flaccid paralysis. So heat labile prevents acetylcholine release, and it causes flaccid paralysis. Now, it's caused by the release of a preformed toxin in honey given to babies less than 1 year old, and this will cause floppy baby syndrome. Botulinum is also in Botox, causing facial muscle paralysis. The bacteria that causes this toxin grows in soil and can be found inside cans of food that are improperly processed. So canned foods, Botox, honey, and heat labile are the 4 takeaways to take from here. Now, what are the signs and symptoms of botulinum? So this causes a descending flaccid muscle paralysis because we are inhibiting acetylcholine release, so therefore we don't have any muscle movement. And the 4 Ds, double vision, which is diplopia, difficulty breathing, known as dyspnea, difficulty swallowing, known as dysphagia, and motor speech disorder difficulty, known as dysarthria. So how do we treat botulinum? Treatment of botulinum is with a drug called antitoxin, also known as your human botulinum immunoglobulin, which is a mixture of immunoglobulin fragments that are indicated for the treatment of botulinum serotypes A, B, C, D, E, F, or G. Okay, and that concludes our topics on our exotoxins. So stay tuned for the next video where we will continue talking about Perfringes, Staph aureus, and Pyogenes. Thank you.